Guy comes into the doctor and says, "Doc, it hurts me when I raise my arm above my shoulder." And the doctor says, "Don't raise your arm above your shoulder." First, do no harm is a general principle of medicine. And in the strain of illness or injury, lightening the load, comforting somebody is actually a requirement. If you have a cancer diagnosis, if you have a life-challenging diagnosis, any diagnosis that takes you out of the usualness of life, there's a heaviness to this. How do I find myself? How do I lighten the load and take a break from it? I'm carrying 100 pounds on my back every day for weeks and months as I'm going through this. I'm tired and I need a rest, and sometimes humor's a reboot. There are clearly wonderful physiologic benefits. There are endorphins, so natural chemicals that help relieve pain. There's actually brain imaging, which allows us to see what lights up when people are laughing. And it's a very sophisticated and complex phenomenon, so that to some extent the brain pattern of activity is like deep meditation, which is why after laughing people can also have awarenesses, revelations, transcendent moments in which they understand things more fully. So this patient who I'm just walking out of the room with comes in and he goes, "I have a rash." And I say, "Have you had it before?" And he says, "No." And I say, "Well, you got it now."